Hello and welcome to today's Rate Fast Speed Seminar, the PR4 Report Revealed. I'm Dr. John Alchemy and thank you for joining. Let's start off by defining what a PR4 report is. After a patient has been injured and has received treatment, the PR4 report is a summary report that discusses all this information in a single place. It will talk about medications that were provided, therapies that the patient has completed, and any diagnostic tests or consultants that were involved in the case. If the patient had a surgery, this would be involved here too and described. Next, and very importantly, it includes a detailed set of measurements of the injured body part. This is necessary so the injury can be processed and rated through the AMA Guide's 5th edition in California. This exam differs from those that precede it because it includes a list of 34 activities of daily living and also a very special and specific method for performing the physical exam and obtaining the measurements that will be used in the impairment value rating. I often refer to the PR4 report as the tax return of the injury because all the information needs to be brought together in a very specific and organized way so that the value of the injury can be understood and calculated objectively and reproduced by other stakeholders who are in the workers' comp system. When a report is written clearly and concisely, it avoids confusion, frustration, and is less likely to be contested. Now, people sometimes get confused about the PR2 report. We've addressed that in a different speed seminar. But PR2 reports are more management reports and are different than the PR4 report. But it is the PR4 report that will determine if the patient needs future care and ongoing office medical visits and or treatments, and you may have PR2 reports that follow a PR4 report. Now let's clarify and revisit that term, MMI, also known as maximal medical improvement. What does it mean? It means that the condition is stable and unlikely to change within the next 12 months with or without treatment. Also remember this, a PR4 report may not be written if the condition being considered for rating is not at MMI, or maximal medical improvement. Check out the AMA Guide's 5th edition definition for maximal medical improvement in Chapter 1, Philosophy, Purpose, and Appropriate Use of the Guides, page 2, section 1.2. So here is an example for a maximal medical improvement and PR4 report indication. A 35-year-old female injures her back lifting at work. She undergoes treatment and has an MRI which shows a herniated disc, clinically concordant with her symptoms. She is sent to the surgeon and surgery is offered, but she declines. She has exhausted all conservative measures. Is she at maximal medical improvement and ready for a PR4 report? The answer is yes, and the key is because she has received and or consented to all medical treatment. She declined to have the surgery, and therefore there is nothing left active to do in the treatment management of the case. So this individual is to be considered MMI, and a PR4 report and rating may now take place. Now her option for surgery may simply be placed into the future portion of the claim, and therefore she may receive ongoing visits and ongoing PR2 reports for ongoing medication therapy, or if she decides to change her opinion of wanting to go forward with back surgery. This ends today's speed seminar on the PR4 report, If you would like to read more, please go to our blog at rate-fast.com and learn more about other fascinating aspects of California workers' compensation and impairment rating.